Our guest today is Dr. Hanriet Minasian.
Yes, I loved her. I thought she was so great.
Yeah, she's an internal medicine physician by training, as really focused on weight management and female health.
Yeah, and she transitioned her practice because she wanted to spend more time with patients.
Right. And sometimes that's necessary. Actually, most of the time it's necessary in medicine. If you want to have the time to spend with your patients to give them what they need, it does mean breaking away from the norm.
Yeah.
And so she's developed this brainchild is really called the Healthy Silhouette, which is a way or a direction of trying to make people as healthy as possible, and as a side effect, they lose weight as well.
Yeah.
And so she combines internal medicine one part, a Healthy Silhouette in the other part of her practice in Pasadena, Glendale.
Yeah.
Fascinating, interesting. I think you'll enjoy it.
And she brought her 2 beautiful children with her, which was really fun.
Yes, it was good.
Enjoy.
So, but what do I know? I'm just a vagina doctor. Hanriet Minasian.
Yes.
Did I pronounce that correctly?
You did.
Thank you. Welcome to the Vagina Doctor podcast. It's great to have you here.
Thank you for having me.
So just a little bit about the podcast. Karen's here with us for our listeners to know that the other person in the voices is Karen. She's my right hand in lots of aspects of my life. And so she will interrupt us if she feels we're getting a little too medical or too scientific. She'll interrupt for other reasons too, actually, and ask questions. And this is just for everybody's benefit. So you're an internal medicine physician.
Correct.
You've been in that position for 18 years in Pasadena.
In La Cañada, Glendale, California. Yes.
In Glendale. But actually, thank you for doing the paperwork that you sent to us. But I have more questions about before that.
Okay.
So the fun fact about you was that you learned English listening to MTV music in the 80s.
Correct.
So tell me where you were, what you were doing, what was happening there.
So I was actually born in Iran, and my parents fled Iran during the revolution, and we moved to Sweden in order to arrange our paperwork to come to the United States. That was ultimately the goal. My parents wanted us to pursue our education.
Yeah.
And so fled Iran, went to Sweden, lived there for 2 years until, my aunt had done all the paperwork, sponsored us. We came to the United States, and then initially moved to Michigan for about a week, and then
oh my gosh.
Yes, and then my mom, in her wisdom, I at the time was about 6 years old, so my mom at that time was like, no, we're not doing Michigan. So moved to Los Angeles, where there's a large Armenian community, which was important to her for us to maintain our ethnicity. So we moved to Glendale, California, and I pretty much lived there most of my life until I moved out during medical school. So it was you're an immigrant, you're trying to master the language, your parents don't know the language. So MTV had just started. This was in the early 1980s. And so when you're listening to someone, and music is an easy way for me to remember things. It's an easy way for me to kind of memorize, even like facts. So it just happened. And I used to be one of those kids that would write down lyrics, sometimes inappropriate, but I would write down lyrics of songs. I didn't know that they were inappropriate.
Well, yeah, because when you're young, you're not even listening. You're not.
No, you're not paying attention to what the words are saying. But so I used to watch them. And so now I always have a very soft spot in my heart for 80s music, because when it comes on, it just reminds me of how far we've come from like an immigrant family to, luckily, my parents just were very wise and have created great opportunities, and my siblings and I have all thankfully done really well through education, and we've been able to make a very good life for ourselves. So I'm very proud of that.
How many siblings?
I have an older brother and a younger sister. I'm the middle child in every sense of the word.
That's great. I'm a middle child too.
Yes.
I'm with you.
You've had extensive training in neuroscience and nutrition and internal medicine. Your residency was in internal medicine.
Correct.
And that's what you've been practicing for the last 18 years.
Correct.
And the last 2 years or so, I'm sure it was building up before you actually started Healthy Silhouette.
Correct.
2 years ago. But that sort of puts together, it's basically a brainchild, combining all of your experience before and since medical school, residency as well, of course. And you're doing weight management, regenerative medicine, and non-invasive body and face sculpting.
Correct.
And wanting more. And that's one of the reasons why you're here today, is to talk to us and see how we do some of those things.
Correct.
Let's, for a moment, talk about the programs that you're running currently for our listeners, and just to let them know a little more about you and exactly how you treat patients. First of all, with the weight management and regenerative medicine, what's your approach to those patients generally? It's probably changed in the last few years as weight management has changed.
It sure has.
Significantly. But how do you, for the patient that comes in to see you, what's that journey like?
Weight management's a very interesting thing to treat. It's one of the number one treatments for most of the chronic diseases that I treated on my medical side. So diabetes, hypertension, hyperlipidemia. Yeah. Weight loss is key to treating those diseases. So it's always been part of my treatment plan on my medical practice side. Unfortunately, weight loss is such a complex issue. It's never just as simple, to be honest, even as a medication. It's just not as simple as reducing calories. It's kind of a combination of multiple factors, which is why it's such an interesting and such a complex disease, I would say, to treat. Absolutely. Obesity is. Yeah. And so for me, I feel like my approach is, given obviously my specialty, I have a master's in nutrition. I've actually worked in an eating disorder clinic. I was the medical director for several years. So I have very strong feelings about food, nutrition, the psychology of eating, which is also very key to weight loss. I am a board certified internal medicine physician. So I believe in obviously thyroid optimization, metabolic balance, hormonal harmony. So my approach is to almost treat all of it. And why I feel so strongly about weight management, and rather than calling my practice a weight management practice, I consider it more of a wellness approach, because I feel like just calling it weight management is a disservice, because the weight loss is just a benefit of doing all the other things appropriately. Yeah. If you are eating correctly, if you are hormonally balanced, if you have the correct activity, if you have the right headspace, the weight loss comes. And it comes in a healthier way, it comes in an appropriate way. So my approach is multifactorial. We start off obviously always doing a medical evaluation, making sure hormones are okay, thyroid's okay, electrolytes are okay, some of the vitamins, minerals. So I start off with my medical hat, and then we work on, why do they want to lose weight? What's their goal? Is it realistic? Why is that the goal? Because that's also important to address the why. And that comes from my eating disorder background, because that can be very pathologic. To just look at a scale and just say, inject this medicine and here you go, 10 pounds, right. That's not, going to work. And then, of course, we do use a lot of the medications prescription-wise, including the GLP-1 inhibitors and the incretin mimetics.
Wait, what's that?
Those are the new medications that are very popular, the tirzepatide and the semaglutide.
Okay, right.
So we do use those. We use other prescription medications. There's several other classes of medicines. But I definitely do not have a one approach type of, approach to anyone's weight loss. It's more of like, let me see, I'm meeting you where you're at. Yeah. So you tell me, where are you with this? What's your goal? How far are you from it? Because what I would tell one person is not what I would tell the other, because they could be in very different places in regards to their lives, their, what access to food they have, right. What access to medications even they have. So I believe, and how active they are, what recommendations we would make for that, what their body goals are.
Are you doing any, you going back to your testing, are you doing like any like swab like testing or just blood work, or what does your testing look like before someone starts any program like for weight?
At this point, we're only doing more of just traditional laboratory evaluation. My practice kind of was born out of my medical practice. So it's an interesting transition. A lot of the patients are used to seeing me on the medical side. And so, I kind of just moved this as a smooth transition into the weight loss. But now we don't do swabbing yet. But these are all areas, to be honest, what I've learned is that the practice takes me where it needs to go based on my patient's needs, what they're open to, what they're receptive to. So, but for now, we just do traditional testing and I start from there. And then some of them, if they want to monitor specific markers or have specific questions, a lot of times, and I'm sure you get this as well, like, they'll read something and they'll ask you to do it or to order it. And if it's appropriate, we'll discuss it and do it. So there is no like formula. Yeah. It's kind of like seeing, where are you at? What are your needs? What are you willing to do? What are you not willing to do? And it needs to be something that's long-term. I have a very strong belief. I do not like diet culture, which is funny that I have a weight loss clinic, but I do not enjoy it. I think it's actually counterproductive mentally, physically. So I'd like to meet people where they are and then work with them and hopefully change some habits that are long-term. It's not just about the immediate period that they're using my services. It's to create health. It's to create wellness. It's to, promote all of these things that are good for you on the long term.
Yeah. I mean, we had a endocrinologist on the podcast last month, and it was really interesting to me because we talked a lot about this, you can correct me, metabolic syndrome. And it was fascinating to me because, to your point of, treating everyone as an individual, and also with your eating disorder background, right? A lot of people really messed up their metabolic profile or whatever that piece is inside of them, which needs healing, obviously, which is why they're coming to see you or him or, anyone. And that process is going to be different for everybody because everyone has done a different, I think, harm to themselves in the process of trying to lose weight.
That's actually a good way of putting it, the harm that we've done to ourselves.
Yeah.
Well, it's because we're taking, you read something about a certain, for example, a celebrity that has done something, but you're not looking at all the other factors to that. And I'm sure you hear this, I want whatever, this celebrity's using. But you're not looking at that, for example, that person's lifestyle, their exercise habits, where they are, their age, their hormonal status. Like, you just want to see the end result and one part that's visual. And but I think the important part is to note that you have to kind of master all the facets of it, or else your weight loss or your wellness program is not going to be successful. Yeah. I wish it was so simple that I could just, prescribe you a Wegovy or a semaglutide and you'd be perfect. But if you don't do all the other things correctly, it's a short-lived success. And to be honest with you, I didn't really serve the patient. I believe it has to be very important. Even if they're doing strictly weight loss and it's not someone with a disease state, you still have to work on self-love and how you see yourself and how you are hormonally. Because as you age, that same medication's not going to affect you in the same way.
Well, and that's why I thought you were an interesting person when I originally reached out to you about coming on the podcast, because you made a shift like this in your career, going from just traditional internal medicine doctor to really pivoting to more of a place where you're in a position to really help patients, which is a huge shift, from what you were doing to then really go deeper with everyone.
So do you have two separate practices? Do you have internal medicine and you have...
I do, yes.
The healthful silhouette.
The healthy silhouette and my internal medicine practice are actually in the same space. I have like a separate space in my practice or in the actual building. So it's located in the same place. I do carve out time, and I do have a nutritionist that works with me the rest of the time,
great.
So that she's manning that part of the practice while I'm doing the internal medicine.
That's so important too. The nutritionist.
Yeah,
right.
It's all key. All of it is important.
Yeah,
all of it is. That's So I get a lot of people when they're interested in my services that'll come and say, well, what's the diet you're going to tell me? I get that all the time. Yeah. I'm like, there is none. And then they're like, but I need to know how to lose weight. And my comment always is, first of all, most people know how to lose weight. The point is, you don't know how you need to lose weight. You don't know how to do it yourself. Most people know it's a calorie deficit. They know the basics, but they need to have someone spell out where they are, where their flaws are, and some of it might just be in their relationship to food. I find obviously through my internal medicine practice, there's a huge connection with like mental health and food. So to ignore that, then just say, oh, here's a prescription medication, they're just going to bounce back. So for me, it's always a very important need. And again, this all I think stems from my prior experiences, is that you can't treat weight loss, even truly any medical condition or a gynecologic condition, unilaterally. Like it always has to be, treated from multiple aspects for it to be a long-term benefit and a long-term goal. And so the reason I started this practice was, to be honest, kind of around the COVID time. I guess I should be grateful. One of the benefits of it was I was very frustrated with the medical side, in the sense of limitations in time, limitations in the amount of access to certain things. And unfortunately, on my medical side, I can't spend an hour doing a diet review or explaining to them, that they need to do some self-love exercises or talking about what were their barriers. And it's unfortunate, but that's just the truth.
That's where I was really glad that you started talking about it from that point of view, the time factor.
Yeah.
Because I stopped taking insurance 15 years ago just because I couldn't afford the time that the patients needed, or what I thought the patients needed. And I've been lucky to be able to do that. It was certainly associated with surgery as well, because that laparoscopic surgery was the main part of my practice for quite a while. But it seems to me, and this is very common with the people that we've had on the podcast, is they've generally all had to break away from the insurance system because they couldn't make it work otherwise, if they wanted to do the best for the patient. Has that been the case for you?
I mean, I'm still keeping the fight. I don't have any immediate plans for my medical practice. I mean, to give up my medical practice in a sense. And the reason for that is just I've built such incredible relationships, 18 years of seeing most of these patients. And I treat everyone from now grandchild to grandma. So it feeds a different part of my soul. Yeah. But this practice also feeds a different part of my soul, which I was not getting from my medical practice. And so I've realized that if I want to kind of continue, and I love medicine, I love what I do, feel very blessed. And so I want to feel that way. And if I had to shift a little or pivot or create another environment for me to practice the way I want to, that's what this healthy silhouette is affording me, that practice.
Yeah, and I think that's great that you can do both, really.
It's not easy.
Yeah, I was going to say. But you probably kind of know the person that walks through the door that is that person that's going to go, right, to the other part.
Yes, I mean, all types of wellness practices, or a lot of, even medical practices. I always say there's thousands of doctors, correct? And we all have the medical training. I think what attracts a patient to each of us is, just like any other relationship, your approach. Do you speak to them? Do you understand them? And not to say one is better or worse. It's just who you click with. Yeah. And so I am going to appeal to a specific type of patient who doesn't necessarily want the short term, okay, just give me a semaglutide injection and I just want to lose 10 pounds for a wedding. I always say that's not my goal of my practice. My practice is more of like, let's make some changes so that menopause is easier for you, so that you are healthier, so I don't have to worry about you having diabetes, or your bone health is good, and that you also have weight loss and that you feel good and you feel positive.
It's like really just what an internal medicine doctor should be, looking at checking all those boxes.
Yeah, and sadly, unfortunately, with insurances, patients are surprised. They're like, why can't you do this on the other side? And you can't. There's just the time factor is huge. Access to even a lot of the injectable prescription medications are impossible.
Right.
And I even am one of the rare unicorns in my area that tries to do prior authorizations. But I mean, as you can imagine,
oh gosh, what a headache!
It's impossible to keep up.
Yeah,
with. It really literally is. But
you just mentioned the magic word, which is menopause. Obviously, you're working in that direction as well. And equally obviously, that's my specialty. Or it's actually become, OBGYN generally was what I did. And it was delivering babies initially, 45 years ago when I came to Santa Barbara. And then it morphed into surgery when we had the start of laparoscopic surgery, minimally invasive surgery. And then as I grew older, my practice grew older with me, and so suddenly there was menopause and all of the things that throws at patients and at physicians. So, and you're involved now with hormone replacement therapy, and you are taking the training through the North American Menopause Society, or
correct,
as they now call themselves, the Menopause Society. So. But I use the statements from the Menopause Society significantly in my practice when I'm talking to people about the safety in starting hormone replacement therapy early and continuing on. But my big criticism of them is they don't go far enough. And so... And I'm finding that disappointing, and I do believe we need to be more aggressive about treating and treating for longer. But it's not just the simple vasomotor symptoms that people have, and I say simple because it's not simple, but it's the first thing that most patients have experience with and are bothered by. What's your what are you doing? How are you handling the menopausal patient now?
So
the 50-year-old that's symptomatic and wants to find out what the pros and cons are.
So, in my internal medicine practice, by nature of my demographic and also just by nature of the patients, there's no way I can avoid treating menopause. Right. I do adult medicine, so 18, and if they live long enough, every female is going to be in menopause. So, my initial approach is always, I do pap smears in my office. I do them myself, and obviously I also refer to the OBGYNs in the community as well. But for the patients that I feel I'm appropriate to treat, I do them in the office. So I take advantage of their annuals, and I usually will ask them specific questions. Right. More recently, even throughout the process of getting certified by the North American Menopause Society, I've also it's awakened me to ask more specific questions. For example, I do get a lot of patients that don't necessarily talk about the hot flashes. They'll come in and they're in their late 40s, and they'll say, I'm getting my periods, but I'm having palpitations, or I'm having a lot of dizziness, or my joints hurt really bad, or I'm having weight gain. So, and then of course, then there's always the discussion of, can you check my hormones, which is what, and it's like, well, those might not give us the entire story. I can do them, but they don't always reflect what needs to be done. So, we basically start with, first of all, I always make sure anyone who's going to even consider discussing hormone replacement therapy, whether it be complementary, some people want alternative medicine, which is fine. Some people want prescription, some want compounded. There's plenty of wonderful compounding pharmacies I work with locally as well, if that's what the patient wants to do. But I make sure all their screening tests are done. And I explain to them the importance of it. Everything my approach to anything in medicine is everything is like a list. That's probably my personality, pros and cons. Mm-hmm. So at any given point, just sit and look at where you are, write the pros to you at that moment. Now, can it change in 5 years, Can it change in 10 years? Of course it can. But then we can have that discussion again. So I like to kind of sit down and say, hey, for you, these are your pros, these are your cons. So, for example, you have family history of breast cancer. You do not. Certain other risk factors of their behavior or their obesity or things they could do lifestyle-wise or anti-inflammatory foods or improved treatment of their metabolic syndrome. So it's a very, I kind of sit down and I make a list of what's bothering you, how much is it bothering you, is it keeping you from doing the things that you love? And then there's always the question of should I treat, should I not? And I too cite and I tell them, listen, if you're considering it, it's better to do it sooner. Most of the studies suggest if you do the hormone replacement in the first 10 years, you get more of the benefit out of it.
Right.
So don't wait till you're like 65 if you went to menopause at 50, because you're just going to suffer for 15 years unnecessarily.
And then not be able to take it afterwards.
How do you feel? Where do you stand about even women doing a small dose before they actually go through menopause? Where do you stand on that?
I think everything is very individual. It depends. It depends on what symptoms they're having. It depends on, again, their risk factors. As long as the patient and I are communicating and we have an understanding and that we understand the risks and we understand the benefits and we're doing all the things to mitigate risk and doing all the things to maximize the benefits, I think any decision in medicine, if it's done correctly in that way, is a decision worth making. So I'm comfortable with it. Less often do my patients approach me pre-menopause, but a lot of them now I think are starting to see that their symptoms are from menopause.
Yeah.
And I think it's also, you have to change their view of it. They can, sometimes they're like, what does my heart rate have to do with menopause? And can you send me to a cardiologist? Not a problem. And then surprise, surprise, cardiology, $1 million workup comes back negative. And they're like, but I'm still having this. And then they start doubting themselves. Like, am I imagining this? Is it? I'm like, no. Am
I having an anxiety attack?
I mean, and they may be, but they also may not be. Yeah. So it's one of those things that for me, if the patient is having symptoms, we've exhausted, and I'm more than happy to do the full workup. Of course, I think it's warranted. Sometimes more so to even convince the patient that it is, because I know they don't have cardiac issues. They go to Zumba 3 times a week. That's worse than a stress test. So your cardiac stress test is going to come back normal if you're, running on a treadmill for hours every day. But for me, it's kind of one of those things that if the patient and I have discussed it, the risks, the benefits, and we're willing to do it, I don't have an issue. Nothing's written in stone. Everything can be changed too. I think sometimes people forget, like, oh, if I make that decision today, am I stuck forever? No, there's things you could do. But one of the things I do remind them is certain things, if you don't do, might not be an option in the future. Right. And that's the part that they don't sometimes necessarily see. They're like, well, I'll deal with it later.
Yeah, one of the problems, I can't imagine really what it's like in Glendale for this particular issue, but Santa Barbara is very conservative. And the physicians even more so. So a lot of my patients who are on hormone replacement therapy will be seeing their internist, the primary care physician, once a year, and so frequently they're told by their doc, no, you need to get off those, you're going to get cancer. And I mean, this is more than 20-year-old thinking. It's wrong,
right?
But it's a bit of a hurdle. Most of the time, it's not a major hurdle because people that are coming to see me know what I do, and so they don't change, but they do often need reassurance, and that's one of the things that I think the medical profession has been very slow to adopt this. And it's not just primary care physicians or internal medicine physicians; it's gynecologists too. Right. They don't want to put people on. Very few of the other gynecologists in Santa Barbara use hormone replacement therapy for their patients. It's crazy. So, but it's always been enjoyable to me to push the envelope a little bit.
Well, I mean, I think, like you said, people approach you because they know who you are or know your approach. I do get a lot of. I think it also helps, given like my age, my demographic, that they feel like, okay, well, she can relate. Obviously, it's. They can understand, they can feel comfortable talking to me about some of the symptoms. And I've always never been like the shy type to not bring up like,
Really?
vaginal dryness or, can you tell? But I think it's just one of those things that it is important. But unfortunately, like, you do sometimes, I always say you should do whatever in your heart you feel you can do. My job is to facilitate that for you. If you are more worried about the risks than you are the benefits, then don't do it to you. But I'm telling you, here's the benefits. Are you fully understanding that these are the benefits? If you're telling me I'm worried about a clot, but you have no risk, but you have huge heart disease, and I feel like it can reduce your heart disease risk. So sometimes when I explain it in that sense, then it can, and again, nothing is absolute. You do it, and
it's so much of it is about listening to patients and making them aware that you're listening to them, and generally they're sensible.
Yes,
and at least coming out of an appointment with you, I'm sure they're much better informed than when they went in. One of the things that we were at a meeting, and InMode was the company. They're basically a cosmetic company that has done some really great things in terms of looking at women's health, and more focused on that than most of the other types of companies that produce lasers and radiofrequency devices and so on. I've found them to be the most forward-thinking of all of the companies that I've worked with. And the piece of equipment that I use a lot is called Empower RF. I've had that for about 4 years, but I want to get back to the menopause in a way, in that it was 8 years ago that the fractional CO2 laser Mona Lisa came to these shores. And when I first heard about it, I thought it's ridiculous. Not going to do anything. But then I saw some scientific studies and some histology of before and after biopsies, and thought, well, wow, this really works. And so we got this piece of equipment after talking to some really, some forward thinkers, people that I trusted, and I thought, okay, well, wait a minute. How do we approach the patient with this? I've got something that's going to help their painful intercourse or lack of intercourse, but it wasn't normally the case even for a gynecologist to ask about people's sexual function and the pros and cons. So we changed entry paperwork, asking patients if they had any pain with intercourse, had any urinary incontinence. And if they checked that box, the door was open for me to talk about it. And my practice changed. It changed radically. So I was not doing much in the way of surgery. And now I was treating with non-invasive methods significant problems that were much more plentiful than I ever thought. I mean, some of the studies as I was reading it and hearing more and more, I realized how prevalent these issues were. And as I said, my practice changed just because we changed the paperwork in the office. And then we went from fractional CO2 laser to radiofrequency, other modalities of laser, which frankly never did any better than CO2 laser. But what InMode brought into the picture was bipolar radiofrequency, microneedling to this. And microneedling just, causes everybody to take a short, sharp breath. But it's actually a pretty comfortable procedure to be done. And I found that I thought, okay, I'll still be doing the slings and pelvic floor support surgeries, and some of them are still necessary. But I found that utilizing these non-invasive methods has decreased the amount of surgery that I've done. And patient satisfaction is high, because even with the surgery for urinary stress incontinence, there's a failure rate of about probably close to 10%, between 5 and 15, certainly. And the complications that can occur with it. So this is, I can live with this easier. I can actually sleep with it easier when knowing that I'm not likely to have any great complications, because we haven't had any of these complications. And that's what, you said when we talked previously that you were more interested now in the urogynecological issues that were coming up. And basically for our listeners, that is a condition called genitourinary syndrome of menopause, which is a good example of women's health care being forgotten or displaced. Yes. It's like genitourinary syndrome of menopause for our listeners is a combination of symptoms of vaginal dryness, painful intercourse, lack of lubrication, urinary frequency, urinary incontinence, overactive bladder, and 50% of postmenopausal women will get those symptoms. And now we have a treatment for it, which requires no downtime, no preparation time, no surgery, pretty much no anesthesia, and success. And so this is changed things, and because there are more and more people who are willing to talk about it, and we can advertise it, that we have treatments for these types of things. This is what you're interested in getting into, I believe. I mean, you're doing some of it already with the hormone replacement therapy, because first line of treatment for vaginal dryness and lubrication is vaginal estrogen. And if you wait long enough, it works fine. But if you want a little acceleration to it, you've got these other methods. And so my experience, and I've got more machines than I really want in my office. And I think I bat about, to use an American expression, I bat about 500 with them, meaning half the time they work and half the time they don't work. Long term, those that work very well, and those that don't work don't work. So I've made mistakes in things that I've purchased, but I still use Mona Lisa. It works well, but it's limited. And what is not limited is the Empower RF equipment, and that's just opened the door, and it's really good, sensible thinking that's come from the company. I don't. It might sound like I work for the company, but I don't. I have been to a number of conferences that they put on. I was on the panel in one, but I'm not officially an advisor for the company. So I'm just talking about Empower RF, because the machine is so versatile. But I use it for GYN purposes, just Urogyn. But it's great for skin rejuvenation all over the body. It's great for skin tightening as well. And then there are a couple of other little things that are helpful with the electrical muscle stimulators that are there, the V-Tone.
People like that V-Tone.
Yeah. I have the Evolve X by InMode, which is what we use for the body sculpting. So that's the device that I have. Yeah. And I have the M-Face for the face, which is high Fez and radio frequency combination. So they both technically do the same thing, two different companies. But I have the Evolve X machine, which is what I love. And that's why that's the one I chose because I like the muscle stim component of it, because that's a major thing that happens is sarcopenia, which is muscle loss in postmenopausal women.
Yeah.
So if you don't address the muscle, even just tightening the skin is not going to give you the results that you want. The muscle is actually the key to a lot of this. So I think they are smart in addressing these like muscle treatments, because
that looks like a great machine. Do you like it? Do your
the
patients
Evolve X?
love it?
Oh, they love it. We combine it with like our for like the weight loss patients. It tightens their skin, reduces subcutaneous fat. It'll stimulate the muscle. I sometimes get women with diastasis recti who've had children recently. It helps the abdominal muscle strengthen. It sculpts them nicely. So sometimes even when they think they need to lose more weight, or most women will say, "Oh, I want to lose more. I want to lose more," but it'll sculpt them appropriately, because when you lose weight, you can't control where you're going to lose the weight, right? Some women will lose it in the face. Some women will lose it in the glutes, but this helps sculpt specific areas. So it kind of
is the skin tightening and the muscle contraction. Is it one treatment, or
yes,
it's two different treatments?
No, it's on the same thing. They have a transform arm. The Evolve X machine has 3 different arms to it. It has one that's called Tight, which is just skin tightening, where it's just the radio frequency of an area. And then there's the Tone, which is just the EMS. So I use that, for example, with patients who've lost a lot of weight but are losing a little bit of muscle tone, want to help the glutes tighten or lift the butt. But the transform, it has the combination. So it has the tightening, the subcutaneous fat ablation, and the muscle stim. So it does kind of all 3, which is, I use that most. That's the arm that we use the most of.
And
that
how
device.
long does that treatment take? Let's say for glutes.
So it's about, each treatment is about anywhere from 30 to 60 minutes. And there's no downtime at all. It's not painful. They don't have to numb. We don't break skin. It basically, you put the little devices with some ultrasound gel over the area, and you feel heat, and I call it the zap. So you get a little bit of heat. The heat is the skin tightening and the radio frequency fat ablation component of it. And then the zap is the muscle stim. So, and it's controlled. So we try to obviously adjust based on the patient's comfort level. And usually we go above what they think they're comfortable with, because most people get afraid. But you want to get the best result. It's not meant to be a spa treatment. It's actually like a solid treatment, but it's not uncomfortable, and they can proceed with whatever they need to do right afterwards.
And how many do people usually get or sign up for?
I mean, we have packages of like 6, 12. We have some patients that have done, like, we usually say 12 to like an area is a really good treatment, and then do maintenance. But I always, the way we describe it to our patients is it's like a workout. So if you tell me how many crunches should I do for my abs to be strong, for 6 weeks, you could do it. But if you don't do it, then, you want to maintain it, and it just depends on your body. Some people, certain parts of the body, like where we'll sculpt the arms, the back of the arms, the deltoids will be like beautifully done in a few sessions. They'll like their changes. Smaller areas are easier. The abs tend to be the most resistance, because you have the greatest amount of subcutaneous fat. The glutes do really well. The bra line, a lot of people in the back, do not like the bra line. That's easier to treat, but it just depends. It depends on the age of the patient. If they're younger, obviously there's a quicker response. They're based on the health of their skin, their hydration status, how athletic they are. So it's a combination, but generally by 6, I always say when we do the abdominal area, traditionally we get about a centimeter reduction per treatment. So after like 3-4, you've already lost about an inch.
Wow, that's great.
Yeah. So I always warn my patients, don't buy a new belt, don't buy new pants.
Yeah. Well, that's a great combination you're doing of different, the weight, the hormones, and these procedures, because you start to feel really good. Like, you're losing weight, but now you're like, I don't like this loose skin.
Right.
Or,
Well, I thought that, any health wellness program should have an activity component, should have like some kind of medical component, and it should have like mental, like there's all these components. So I was like, how can I make people exercise? You kind of can't. That's where the weight loss problem is hard, because what they do at home is out of my control. So I figured this was a way to kind of just control at least certain parts of the exercise component, or just get some, and it's, for example, a 30-minute treatment's about 20,000 crunches. So
Wow.
yeah. So it's significant to an area, So that was why I introduced the device into my practice. And then the M-Face, which is the other device I have, was kind of born out of the patients who were losing more weight, or my menopausal women that wanted some treatment but wanted non-invasive. I tend to be more holistic, and I like to do things that just kind of play off of my own natural body's function. And so then we bought the M-Face, which does the same thing. It's essentially skin contractions and HIFAs for wrinkle reduction, and also lifting the face naturally by stimulating the muscles of the face. So,
do you use testosterone?
I don't have a lot of patients on testosterone, not because I have an objection to it per se. I think more women will benefit from it, to be honest, but I think there's a little bit of a barrier to that for some reason. I don't know why. I think it's starting to make its way. Yeah. I'm not a huge fan of the pellets myself, just because I find that they're a little bit more unpredictable in the dosing, and from my experience with my patients. I mean, I know there's a lot of the pellet pellets available, but creams are what more of my patients use. Yeah. But I don't have as many as I think are good candidates for it.
Right.
But I think more people are worried that they're going to grow a bunch of hair on their chin, and and I'm like, oh.
Well, they do. That does happen.
If the doses aren't correct, usually the small doses we use they're not going to be that, women forget that we have testosterone. Mm-hmm. We do naturally have testosterone. So I think it's just one of those things that they think, oh, I'm going to get too bulky, or I'm going to, and obviously you want to monitor like levels, and you want to see their symptoms and create. One of the things that I do in my Healthy Silhouette practice is we do regular follow-up. I mean, the program includes coming in. We also have an accountability component. So it's not just they go in, they come in once a week, we sit down, we do anthropometrics, we weigh, we measure, we talk to them. What were your barriers? Why did you, what was hard? What did you struggle with? So I think it's just the constant monitoring and seeing how it is. So if you're being monitored, if at any point there's any concern, then it can always be pulled back. And again, everything is not appropriate for every single person. I think that's the problem. People see something online and they're like, oh, I want this. And you're like, well, you don't know if your body is going to handle that or how it's going to handle it. So.
Yeah.
I use a lot of creams, and I actually do a lot of pellets also. But the pellets started because patients were asking for it, and they love it, and so it's that's why I do a lot of them, and now it's always an offer to a patient when they're considering HRT.
Right.
But one of the points I was thinking of is. When men and women lose weight, they may lose fatty tissue, but they're also losing muscle tissue.
Correct.
And that's really got to be addressed with patients, that you've got to eat the protein, and you've got to exercise.
Yes.
And so I hate exercising, really. And so... and so, I have to practice what I preach.
Right.
And so it's, but I can understand patients being reluctant and doing that. So testosterone, I think, is helpful.
Yeah.
And when you look at it, I mean, the blood levels we're getting to, they're higher than the normal range of women's dose physiologically, but they're still, 10% of, or at least 20% of a male level, so it's still very low. But some people do, and at very slight increases of testosterone will have some hair growth.
Right. I think it's very individualized, just like every other treatment, and you don't know, or sometimes the benefits they get from it in their libido or their muscle mass are worth the hair growth, because that can be removed. So it just depends on where you're at. That's the thing. All of these are so individualized, and what I don't like about general, like the wellness aesthetics field now is everyone wants things to be cookie cutter, and it's just, it can't be. It's just, we're all very different physiology. We're all, like I said, one patient who doesn't like to exercise, I have, I tell them, I love it when people say, oh, I don't have time. And I said, I understand that. There's never enough time that you want to get up. But, I work full time. I have a family, but I have to make time. If this is important to me to live a long life, to be healthy, to, see the wonderful things my kids are going to do in this world, I need to get up and move. And sometimes I joke with them. I'm like, I put on weights on my wrists and my ankles when I'm taking the laundry up and down the stairs at the house. So I feel more of a workout. You wear a weighted vest when you take your dog for a walk, because everyone knows your dog stops 20 times. And it's not like a great cardio workout, but at least you get the weighted vest. So there's things that you could do. It doesn't have to be, I tell them, put a resistance band around your knees and while you're washing dishes, and just keep the resistance there. It's 10, 15 minutes. You're going to get a little bit. Any workout is better than no workout. And I think now people want to do, I have to go to the gym for 5 hours a day. And I understand that most people don't have that luxury or the desire. I
don't understand anyone that wants to go to the gym for 5 hours.
Yeah. Well, I will assume there are some people like that. Neither of us clearly are that group. But I think, I think it's just very important to kind of understand that people look at either I have to go to the gym or I have to do nothing. There's no in between, and any activity is good.
Right, when you're cooking, you can just you can knock out some squats and some push-ups.
I joke
some burpees
on my Instagram. I had this 10,000 steps a day challenge for for about 6 weeks prior to summer, and the funniest thing was I used to my office is on the 3rd floor, and I park in P3, which is so I go up 6 flights of stairs every morning, and I would record myself going up, and I would tell people like, hey, listen, trust me, I don't want to exercise. I would much rather just take the elevator up to the 3rd floor, but that's my exercise. That's like a little bit of cardio. My heart rate goes up. So you have to do something.
Squeeze it in. It doesn't have to look a certain way.
No, 5
minutes.
With you. 5 minutes, walk in place, any of it. But I think it's just the mentality is either all or nothing. But that's where the beauty of a program and why we try to stress kind of accountability in our weight loss program is for that reason, is to kind of make sure that we're always reminding them, like kind of like a sheep herder. When you kind of get off, you kind of, oh, no, come back, that you're doing all of the things. Because if you're going to invest time and money into anything, you want to do all of it. Why not get the best result? Absolutely. Yeah.
Well, thank you.
Thank you.
It's been great meeting you. Great talking to you. You've obviously got a great practice and moving in the right direction. I mean, it's where it's all about increasing healthy lifespan.
Yes,
and
I agree.
Exercise and hormones have a huge part of that.
I agree.
And we need more people like you.
Oh, do you do telemedicine?
I do.
Great.
Any questions?
No, I think you've been a great guest. Thank you for coming, and we should stay in touch. And I know you're heading over to the office now, so
yes. No, thank you so much. I really appreciate you guys having me, and thank you for your
pleasure.
Hospitality here. This was
thanks
fun.
for bringing the kids too.
Oh, they're the greatest, aren't they?
I can tell they are, actually.
I'm biased, but yes, I agree with you 100%. The best thing I've ever done in my life for those two. So,
great.
I get it.
Absolutely.
Thank you very much.
Good.
Yes.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.